I want to get your view of things. The government says it was prepared. It was revealed from the Royal Commission this week that it wasn't. What's your view of this?
Well, I don't see signs of preparation in the Victorian, in the private aged care sector here in Victoria as we hit the second wave of the pandemic. I think if there had been greater preparation, we wouldn't have seen, we've got some 140 private aged care facilities where we have an outbreak compared to 3 in the public sector, which is the state government responsibility. So if there was a plan, it was very poorly executed. But I think the important thing from our perspective is there's no point looking back at the moment. There will be time for that. And what we just have to do is try and make sure that the residents are safe, and also that we've actually got staff to staff those private aged care facilities, because the Commonwealth Government is relying on the state government nurses to actually work in these facilities now.
I know you don't want to look back, but some of the information that's come out of the Commission this week has just been harrowing. Can you explain some of the difficulties that that nursing staff experienced, some of the scenes that they experienced?
Yes, the staff that went in from the public sector into some of the private aged care facilities, and I do want to stress it's some, I'm not bagging everybody, but it was a reality. We had people weren't given a handover. It was inaccurate what they did get. Some residents weren't actually in the room that the handover said. And when you go in as a nurse for the first time and you don't know those patients at all, that makes it very challenging. There wasn't enough, there was no one from the private aged care facility to, for example, I'm talking about Kirkbrae, to actually meet the nurses and orientate them to the ward or to, the private aged care facility. And the food was being delivered, but there was only 3 of them on. There were residents that were unwell. There were 22 to 27 residents that actually had had tested positive for COVID-19. There was nobody to assist them by answering the telephones. One cleaner that was, in small bins that were overflowing. They had kitchen sort of standard gloves instead of proper gloves. It was an appalling scenario for those nurses. Now, that doesn't sound to me, like a COVID plan was in place. But, importantly, our members have been campaigning for decades in relation to the parlous state of private aged care, the lack of staff, the lack of resources that they have access to them. And I think one of the things that frustrates our members, and certainly the Federation, is that sometimes, it has taken the pandemic for actually people to get interested in, the state of private aged care in this country. It took a television expose of 4 corners to get the government to announce a Royal Commission. So we are very slow to act, and we want to make sure that the promises that will no doubt get made are actually implemented, and this just isn't yet another inquiry or another commission into private aged care that does not see those that are most vulnerable as the people who should benefit. And we want our members to have access to more staff.
Do you believe unpreparedness cost lives?
Yes, I do, because I think early on, when you look at St Basil's, for example, some of those facilities, yes, I do believe that there were residents who ended up with, to the extent the virus spread throughout the facility is, I would say, has caused people's lives, yes.
It's just awful, isn't it? Harrowing and chaotic.
It is, and our members have to work in that situation every shift of every day.
How are they holding up, Lisa?
Look, I think we've got some nurses now that are going to be coming in from interstate, which we're exceedingly grateful for, albeit not large numbers. But there's amazing resolve. Of course, as I said, not every private aged care facility has got we've got 613 private aged care facilities in the state, and we've got some 140. But yeah, it's very challenging, and people are anxious. They're worried about contracting the virus. They're worried about going home to their families. They're getting tired. The wearing of PPE, particularly the N95 masks, is really challenging. It's often quite painful. People are starting to report, pressure marks and pressure sores from wearing those masks. We've got, ICU nurses, the hospital nurses, everyone's working extraordinarily hard. And I guess what we just, everyone's focused on actually getting through it and getting the numbers down and saving as many lives and looking after. We've got some 600 patients in our public health system. So that's why I say, it's not for us to look back at the moment, because we're in the thick of this. We don't have time and the luxury to look back at this stage. We've got work to be done, and that's where our efforts are focused.